Well, you make sure your kids and husband get their checkups, but when was the last time you took a good look at your health? Good health makes you better at any age. There are 3 tests every woman should get.
Julie Amato is a busy divorced mother of 2 young girls.
What do you have so far?
I have zoom, zoom, zoom. The spaceship was flying.
Helping her kids with their homework is a priority for Julie. Also at the top of her list, taking care of her own health.
As a mom, I just think that it's important, one, to set an example for my kids. And I have to stay healthy. You know, there's just not an option for me.
So it isn't an option for Julie to skip the 3 most important screenings for women, beginning with mammograms. Guidelines from the American Cancer Society suggest women get a baseline mammogram at the age of 40 and every year beyond that to screen for breast cancer. Julie has had her first one.
It's very important that we have a way to check the breasts and make sure that there's no abnormal growths. Sometimes you can't always feel a lump. There could be some calcifications that tip us off that there's something else going on.
The second most important test for women, the pap smear.
I had a bad pap smear, ended up being nothing, but I'm glad I had it because she said, you know, we see something that looks a little strange, come back. Ended up being nothing, but that scared me enough. It's like, you know what? I didn't feel different, you know, so anything could be in your body and you wouldn't, you know, you don't necessarily know it. It's not, you don't always have the symptoms, you know.
Pap smears screen for precancerous cells on the cervix. The CDC recommends paps within 3 years of becoming sexually active or by the age of 21, whichever comes first. Then regular pelvic exams and pap smears per your doctor's recommendation. The CDC says 19 million new sexually transmitted diseases occur each year. Some can result in infertility or cervical cancer if left untreated.
Now that we're more aware of human papillomavirus or HPV, we're finding that, you know, a large percentage of women, probably 80% of women, have been exposed to that, and that tends to be the cause of the abnormal pap smears. Just because you've been with the same person for years doesn't guarantee that something from a previous exposure won't come back and show up later down the road.
Finally, screening for a silent killer, a blood test to determine if you have high cholesterol, which can lead to heart disease.
We've focused on men for a long time, and we realize, especially during the menopause transition, lipid profiles in women tend to shift, and they become as at great a risk for developing heart disease as men.
You want to talk to your doctor about your personal risk for heart disease and the possible symptoms. Julie's tests show her cholesterol is low. Her health is in good check, all because she gets checked on a regular basis.
It just feels good to stay informed. You know, it used to be one of those things where I used to kind of be scared to go because I didn't want to know. I didn't want to know about things that could happen to me. It's easier just to not know, and now I want to know everything.
Once again, the 3 most important tests for women according to doctors: the mammogram, the pap smear, and a blood test to check your cholesterol. They'll go a long way in curing one health symptom, worry.